Good afternoon, everyone. Reported cases of COVID in Ontario and Grey Bruce continued to decline during the past week, with cases in both Ontario and Grey Bruce down about 35%. Due to the limitations on testing, this data must be considered less than robust, but we can take some encouragement from the fact that the positivity rate, which also shows evidence of plateauing or declining. Currently, there are reported to be 22 active cases in the Blue Mountains, down from 34 a week ago. The number of people in Ontario hospitalized also started to decline, with 3,645 people hospitalized as of yesterday. Numbers of people in ICU and on ventilators also appear to have plateaued and are very similar to last week. Deaths continue to climb, however, and now average just over 60 per day, the highest level since the post-holiday January spikes in 2021. Currently, there are 13 people hospitalized with COVID from Grey Bruce. 5 people from Grey Bruce died of COVID this week, the highest 7-day total since August 2021. The data shows that having at least 2 doses still provides good protection against severe illness and hospitalization. The ability to prevent infection, which had dropped to 15% after the arrival of Omicron for people who have received at least 2 doses, has now risen to almost 60%, reflecting the effect of people who have received their 3rd booster dose. The latest data from the science table shows that if you are unvaccinated, you are 2.4 times more likely to get infected, 5.8 times more likely to be hospitalized, and 12 times more likely to end up in ICU than people who have received 2 or more vaccinations. It is therefore most important that you get your booster shot as soon as possible. A complete schedule of planned clinics in Grey Bruce can be found on the Grey Bruce Health Unit website at www.publichealthgraybruce.on.ca. The next public health unit clinic in the Blue Mountains is at the Beaver Valley Community Center from 12 noon to 6 p.m. next Monday, January 31st. Appointments are recommended for all. However, walk-ins are available at all public health vaccine clinics. People seeking a 4th dose must provide either a note from their primary care provider or a prescription. In addition, Dr. Tim Remiard is offering vaccinations at the Blue Mountains Community Health Center in Thornbury. All community members are welcome. Appointments can be made online by visiting the patient.mediohealth.com booking/Dr. T.G. Remiard. Vaccines are also being offered at the Thornbury Pharmacy. To be placed on the appointment notification list, please visit thornburypharmacy.medmeapp.ca/schedule. Effective January 31st, Ontario will begin the process of gradually easing restrictions while maintaining protective measures, including but not limited to increasing social gathering limits to 10 people indoors and 25 people outdoors, increasing capacity limits to 50% in indoor public settings, including restaurants, and allowing spectator areas of sporting events and concert venues and theaters to operate at 50% capacity or 500 people, whichever is less. Enhanced proof of vaccination and other requirements would continue to apply in all settings. The province currently plans to ease these restrictions further on February 21st and March 14th, subject to stable or improving health indicators. I am very excited to inform you that this morning the Ontario government announced it is adding 160 new beds in a new long-term care home right here in the town of the Blue Mountains. This home is made possible through an innovative partnership between the town of the Blue Mountains and the government of Ontario. Typically, those wishing to operate long-term care homes submit applications through the call for applications process. In this case, working with us here in the Blue Mountains, the ministry is allocating 160 beds prior to the town identifying a licensee. Once the town selects an operator for the proposed home, the ministry will review the project in the same manner as all other applications. This project is part of the government's $6.4 billion commitment to build more than 30,000 net new long-term care beds by 2028 and 28,000 upgraded beds across the province. The new 160-bed long-term care home is proposed to be part of a community campus of care focused on healthy seniors living, which includes commercial space, multi-residential space, seniors housing, and attainable housing for staff working to support the campus of care. The town of the Blue Mountains will be issuing a request for proposals for proponents interested in developing and operating the different components of the campus, including the long-term care home on municipally owned land in 2022. Construction is expected to start by summer 2024, and the home is expected to be open by the end of 2026. This is a really good news story for our community and our seniors in particular. We are a rapidly aging community, and the 2016 census showed that fully 1/3 of our residents were over 65. 2019 data shows that by 2029, there will be 8,200 seniors over the age of 75 within a 30-minute drive of Thornbury. It is well known that outcomes are much better for seniors when they can age in place, surrounded by their family and friends. Over the last few years, we have put many of the pieces in place to allow us to make this happen. The land, which we are initiating the process to make available, our Attainable Housing Corporation, and our recent RFP for a development manager. I cannot thank the Ontario government enough for working with us to advance this project to bring these badly needed long-term care beds to our community. Have a great weekend and stay safe.